Welcome to the podcast, folks. Today we're diving into the dynamic role nurses play in improving health equity. It's fascinating how nursing links social justice, community, and policy advocacy all in one.
Absolutely, it's quite a field. What really stands out to you about the nursing role in bridging these gaps?
First off, nursing has this deep-rooted history in social justice and community health advocacy. Nurses have always been on the front lines, dealing with not just patient care, but also with systemic issues like racism and poverty. They're practically the unsung heroes pushing for change.
Right, they're much more than just caregivers in clinical settings. So they're also tackling things like housing, transportation, education, and all those factors that shape overall health, correct?
Exactly. Their role extends from the bedside, where they screen for immediate social needs, such as food insecurity or housing instability, to the community level, where they advocate for policy changes that address deep-seated upstream social determinants of health.
Yeah, very holistic. And what about the idea of integrating social care with healthcare? It seems nurses are implementing screenings and acting as the bridge between patients and the social services they need.
Exactly. In the clinical setting, nurses are now actively screening for social needs. They check for elements like food insecurity, utility needs, transportation issues, housing instability, and interpersonal violence. They then connect patients to the right community resources.
Makes sense. It sounds like this approach transforms a hospital visit into a more comprehensive evaluation of a patient's overall needs. But are there challenges that come with these screenings?
Oh, definitely. One of the major challenges is that some patients may feel uncomfortable disclosing personal issues like housing or financial struggles. Moreover, there's the technical aspect, ensuring that the technology used to gather and share this sensitive data is reliable and secure.
I can see how that might complicate the process. But when done, it really is a game changer, isn't it? It doesn't just treat illness, but also the root causes of poor health.
Absolutely, it's a paradigm shift. And moving beyond the clinical setting, nurses are also engaging directly in the community. Public health nurses, for instance, work directly with community members, be it in home visits or through public health campaigns, to address these social determinants on a larger scale.
Speaking of community initiatives, I remember hearing about programs like the Camden Core model. How do they factor in?
Great point. The Camden Core model is a nurse-led intervention aimed at managing complex care for patients, especially those termed superutilizers. These are individuals who often find themselves repeatedly in emergency departments due to, let's say, a lack of proper community support. Nurses in such models work in multidisciplinary teams to coordinate not just medical care, but comprehensive social support.
And then there's the Edge Runner initiative. That seems to take a broader, perhaps even more creative approach to redesigning care models around social determinants.
Exactly. The Edge Runner programs are fascinating. They focus on nurse-designed models that promote a very holistic view of health. These models engage not just individual care, but also group or community-based interventions. They integrate elements like peer-to-peer education, support groups, and advocacy in underserved communities.
Yeah, it's like personalized care that also addresses community dynamics. Now, one aspect I find intriguing is how nurses are positioned to work seamlessly across different sectors. But don't you think that without proper funding and policy support, these innovative models might struggle?
You raise a very important point. There's a tension there. Nurses have the expertise and the willingness to reshape health equity, but they often face resource limitations. Expanding these roles, whether it's in community settings, through telehealth, or via policy advocacy, demands robust investments and supportive public policies.
Totally. So, if I understand correctly, it's not just about individual nurse actions, it's about creating an ecosystem where nursing efforts are backed by broader systemic changes.
Exactly. Think of it as a three-tiered approach. You have downstream factors like disease treatment and chronic management, midstream factors which are the social needs like housing or food security, and then upstream factors which are the broader social determinants like policies and systemic inequities. Nurses are engaging at all these levels, but to really make strides, efforts in all tiers need to be.
It's a multi-pronged strategy. That makes so much sense. It's like trying to fix a leaky roof. If you only patch the inside, the storm outside still causes damage, isn't it?
Exactly. It's if you just treat the symptoms without addressing the root causes, you're never really going to resolve the problem. Nurses, by using their clinical insight combined with community advocacy, aim to change the very infrastructure that leads to health disparities.
Holistic fix. Now, while these initiatives sound promising, some critics argue that there's a lack of solid evidence directly linking nurse-led interventions to reduced health disparities. What's your take on that?
That's a fair critique. There is indeed a need for more comprehensive evaluations. Although small-scale studies, like the ones on the Camden Core model, show promising results, reductions in hospital stays and costs, the evidence isn't uniformly robust across all models. But I think that's partly due to the inherent complexity of quantifying social change.
Yeah, I see that. I appreciate that perspective. Measuring the impact of holistic and community-based interventions is tricky, but it underscores the importance of continued research and adapting metrics to capture real-world nuances.
Exactly. And it's not just about numbers. There's also qualitative aspects, like patient satisfaction, self-efficacy, and the overall shift in community trust that matter significantly, even if they're harder to quantify.
Absolutely. Those soft outcomes often tell the bigger story. Moving more into policy, how are nurses engaging with lawmakers and the public to affect change?
Nurses are increasingly stepping into leadership roles on the public policy front. They're using their first-hand experiences to advocate for policies that, for example, could secure funding for social needs, screenings in hospitals, or drive legislation for improved community health resources. One example mentioned was a nurse in Delaware influencing a colorectal cancer screening program that reduced disparities.
It's inspiring how nurses are not just on the front lines of patient care, but also in the corridors of power, shaping health policies. But do you think this level of engagement is widespread enough?
That's where some might respectfully disagree with the pace of change. While a number of nurses are fronting these movements, the broader nursing workforce still faces systemic barriers, like limited training on policymaking and resource constraints. Yet, initiatives like integrating policy education into nursing curricula are a sign of growing momentum.
It sounds like a work in progress. It definitely seems so. And the push for more comprehensive, hands-on community experiences in nursing education must help bridge that gap.
Exactly, and it's like reconfiguring the very blueprint of nursing education to include community engagement and policy advocacy. This shift means that future nurses will be better equipped to not only treat conditions, but also address the systemic root causes behind those conditions.
Right on. I also find it interesting how these roles require nurses to work across disciplines, collaborating with social workers, community health workers, and even tech companies for telehealth or data sharing.
Absolutely. It's a multidisciplinary effort. For instance, the Camden Coalition model thrives on the interplay between nurses, social workers, and community partners to truly address patients' diverse needs. And programs like these emphasize relationship-based care, which is at the heart of nursing.
Teamwork for the win. Speaking of teamwork, what about the challenges that come with such collaborations? Sometimes it might be difficult to align all these different stakeholders.
That's a valid concern. While multidisciplinary collaborations have tremendous potential, they do come with hiccups, differences in organizational cultures, varying priorities, and occasionally a lack of clear communication channels. It takes deliberate planning and ongoing evaluation to make these partnerships work effectively.
Totally get that. Coordination is key. So, moving forward, what do you think are the critical steps to boost the role of nurses in achieving health equity by 2030?
First, there needs to be sustained investment in nurse education and community-based initiatives. Then, policy frameworks must evolve to support expanded nursing roles, like encouraging health in all policies. And importantly, more research must be done to build a robust evidence base for these models. It's like a domino effect. Better training leads to better care models, which then inform more effective policies.
Exactly, it's interconnected. It's almost like nurses are the linchpin, linking clinical care, community well-being, and policy change. That kind of versatility is rare.
Absolutely. And that's what makes this discussion so compelling. Nurses are uniquely positioned to address individual needs while also tackling systemic issues that cause health disparities. Their work is essential for creating a future where health equity is a reality for all.
Truly inspiring. As we wrap up, what's the biggest takeaway for our listeners regarding this evolving role of nurses?
I'd say the biggest takeaway is that the future of nursing is not confined to clinical settings. It's expansive, multifaceted, and essential for addressing health inequities at every level. Nurses, by embracing roles that span from direct care to community engagement and policy advocacy, can be transformative agents for social change.
That's really powerful. Thanks for that deep dive. It's clear that investing in nursing not only saves lives but also fosters a fairer society for everyone.
Exactly. And as the field continues to innovate, despite challenges and systemic barriers, the role of nurses will only grow in importance. It's a challenging yet incredibly promising
very
path
promising indeed.
toward health equity.
And for our listeners, remember, supporting nursing initiatives means supporting better community health and ultimately a more equitable society.
Absolutely. Until next time, keep advocating for change and supporting the interwoven system of care that nurses represent.
Yeah, thanks for joining the conversation.